Good evening, everybody. My name is John Hartman from SkillPower. And as I sold my last company, I found myself to be in terrible health. The whole package: poor diet, inactive, lack of sleep, and I even triggered an autoimmune disorder that required doctor's care. I knew that I needed to do something about it quickly and permanently. So I began researching all the popular health and wellness apps, actually digging into the academic journal articles to review effectiveness. And what I found was high churn rates and questionable health outcomes at best. I did learn that coaching is an important tactic for some people, but coaching is super expensive and it doesn't scale well. The fact is that the majority of people who start a new healthcare goal have quit within 30 days. And even more surprising is that people with chronic conditions like heart disease and diabetes quit in equal numbers despite knowing the dire consequences. Now, when people are asked the simple question, why did you quit? The number one answer across the board is lack of willpower. You see, willpower is unreliable and we're using it wrong. Our brains are wired to choose short-term rewards over long-term goals, and the existing solutions don't overcome this. Your Fitbit's not going to change the fact that you're staring at the donut, triggering a dopamine response, and altering your brain chemistry in a way that is going to influence the food-related decisions that you make for the rest of the night. We know this because research with modern brain scans is revealing exactly how it is that we make day-to-day decisions regarding our health and how to override them. Research coming out of Stanford is showing us that, in fact, there are three entirely different types of willpower. There's I won't power, resisting temptation in the moment. There's I will power, showing up for that spin class every time. And there's I want power, connecting with a deeper sense of purpose that drives motivation. You see, willpower is not, as some people believe, the act of trying really hard. Willpower is a skill set, like meditation, that must be learned and practiced over time, and when we do, it changes the wiring in our brain with sweeping results for our health. We are here to announce that we have cracked the code and built a platform that teaches these willpower skills effectively and at scale. Our platform boosts our users' willpower to end the cycles of failure and quitting. We tap into deeper levels of motivation that last longer. And we teach skills around behavior change and a growth mindset, which are necessary for large lifestyle changes. And because everybody's different, we customize the entire experience with a proprietary personality typology model powered by machine learning. And you see, our platform is filled with other evidence-based innovation, including a future self coach. It's a digitally aged avatar of you 20 years from now coaching yourself. And after interacting with your future self, your actual brain scans will show that your brain's decision-making process is bypassing the wiring for short-term rewards and sparking action towards your long-term goals. We know this works because it's already being used in the financial service sector, where people who interact with their future self save more money for retirement, their future, as people who don't. We are partnering with Dr. Hal Hirschfield, the future self original researcher, and we will be the first company applying it to a healthcare setting. In our recent research study, we increased measurably willpower with our participants. We decreased intake of junk food and hunger levels, and we improved insulin sensitivity to a degree that is on par with reversing prediabetes. As you can see, one of our participants who lost 7% of her body weight in 7 weeks, she said the program made it easy. My co-founder, Kendra Markel, is here in the audience tonight. She's from the Stanford Prevention Research Center, is a former director of patient wellness innovation at Kaiser Permanente, and a biomedical engineer. She combines this unique experience in behavior change with her deep technology expertise to build innovative solutions for reversing chronic conditions. My name is John Hartman. I have 2 prior exits. I'm an experienced company operator, and I'm an award-winning, data-driven digital marketer. And these are just some of the brands that I've worked with through the course of my career. We have a phenomenal set of advisors from academia to the private sector, and I couldn't be more excited to share with you that we are actively partnering with the Design Lab at UCSD here in San Diego. We are going after the diabetes marketplace first because, simply put, diabetes is the fastest growing disease state in the world. This market for digital therapeutics has been validated by companies like Livongo and Omada, but it is wide open for competition that can innovate and scale like we can. We are going to attack the market through both B2C and healthcare channels, ultimately positioning ourselves to be a B2B2C Intel Inside model, where our customers integrate our proprietary solutions to boost health outcomes and user retention. We are announcing tonight that we've signed our first contract with 8 federally qualified health centers to be the innovation partner in a diabetes reversal initiative. And we're also announcing that we're raising $500K in safe notes to fund the completion of our platform and the execution of these contracts. We hope that you will consider joining. You can download a small sample of our technology at willpowercoach.app. And in closing, we are combining the latest research on willpower science with the greatest digital coach in the world, somebody who really cares about your success. It's your future self. Thank you, and I look forward to speaking with you later tonight.